following program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.
Hello again, and this is Legislative Update, and with my co-host again, Erica Layon, and we're going to be discussing what went on this week in the State House. We were back in the State House again, finally. We spent 8 hours or more on Tuesday, like 12 and a half hours on Wednesday, another 12 and a half hours or so on Thursday, doing all the bills, and yet we didn't finish. We amended the rules so we can come back in 2 weeks and finish. We were nearly done. But anyway, here's the House calendar, the House record. So we'll go over some of the bills, but we spent, I think there's something like 150 bills on consent. The consent, all the blue pages. Those are the bills where we can just vote for all of them with one vote. But any rep can take a bill off of consent, and I think there were 8 bills taken off of consent. Okay, but so, and those we'll vote at the end of on the 31st when we're going back. So, and what's nice is we're back in the State House. We'll show you that in a bit. But I wanted to show you also on roll calls on how to use the new roll call system so you can see how people voted. You can see how I voted. Erica voted. So let's take a bill, House Bill 1639. I remember went through this before, how you can go to the nh.gov and go to the state government and then find the bill. We'll say HB 1639. So I click on it, it comes up, I'll go over to the corner here, HB 1639, and click on it. And then right down here it says roll calls. Now not every bill has a roll call, some are voice. We had a lot this time, or division votes. Okay, I go on here and I can see, okay, how it went, the vote breakdown. So, for example, it passed 183 to 164. Okay. Now, if I say, okay, who voted nay on it? Say Republicans. Who voted nay? I can go click on that. And there's the Republicans that voted no on that bill. Okay? And here's all the people, Republicans that were absent for some reason. And here's all the Democrats that were absent. Okay, and notice no Democrat voted yes on this bill. We'll go through what the bill was in a bit. But see, so that's how you can see, you want to see how I voted or how Erica voted or how, you know, who voted for what. So that's cool how that works. Okay, now, and I just found that out today myself.
I just found out too. I was using my computer with Excel to try and get myself that same information. So thank you, Ralph.
I said, hey, this is cool. But anyway, so we all learned something today. Now, if I go to, and just what it looks like back in the State House, and here, for example, is what we call a parliamentary inquiry, which is how everybody speaks.
Thank you, Mr. Speaker. If I know an aspiring doctor, nurse, or other healthcare professional has very little say in what procedures they participate in, and no law to cite today if they're asked to violate their conscience by terminating what they believe to be an innocent life, and if I know that potential care providers decide early when they decide to take pre-med classes or not, what path they're going to go down, and we don't know how many future nurses, doctors, and other healthcare professionals don't enter this profession because they're afraid that they may have to violate their conscience in this way. And if I know if those tasked to do no harm should not have to undergo harm themselves in order to do their job, would I then press the green button in order to pass this bill?
And this bill was
the motion before us is the majority report of order pass on House Bill 1080. This is a roll call vote. You're in favor, you'll press the green button. If you're opposed, you'll press the red button. Voting stations are open for 30 seconds.
You want to hit pause on that one? This is for the rights of conscience of medical professionals. Right now, a doctor could be asked by their employer or the place where they're training for their residency or anything else to participate in an abortion or sterilization, even if it's against their conscience and even if they believe that it's wrong, according to their religion and their morals. So this would provide a protection for them. This actually is in place in Massachusetts. Some of the opponents say that we wouldn't be able to attract top-level talent if we had this restriction, but I'd say Massachusetts has some pretty good doctors, and we have fantastic doctors here in New Hampshire too. So we're just trying to make sure that people who feel that strongly will go ahead and enter the profession.
And here's an example of me doing a parliamentary inquiry.
Thank you, Mr. Speaker. Mr. Speaker, if I know that this bill is against the First Amendment of the U.S. Constitution by abridging freedom of speech, and Mr. Speaker, if I know it is up to your school district to determine what name or mascot is appropriate for your school, and Mr. Speaker, I know that there are other ethnic names and mascots may also cause some consternation among people, and others may like their ethnicity used. And Mr. Speaker, I know that not everyone agrees on everything. Will you now press the green button to pass this ITL motion? Thank you.
So that was
Motion before us is the Majority Committee report of inexpedient to legislate on House Bill 1260.
Okay, and those two bills passed. In other words, mine was to kill the bill, and it did, and Erica's wanted to pass it, and it did. So anyway, just to show you what it looks like up in the State House now, where we're home, you might say.
For my first time too, so it's great to be in there for session.
Right. Again. So some of the bills that we're going to go over today, and we'll try to do as many as we can, and then if we have to, we'll come back again. Anyway, first bill I want to cover is Erica's bill in education, HB 1663, and that was for...
That was the home education bill where they aren't subject to testing standards that no other student in the state needs to meet. It would remove that. It would provide a better pathway for them to access programs at the local schools because some school boards don't exactly know how to go about it. And this would require the school boards to have a policy that complies with the law. Right. And it just would make things a lot clearer for families.
Right. We covered that bill in our last show on fixing some of the things. For example, in the thing about taking the test and what happens if you don't get the 40 percentile. But what happens in the regular school, a public school, if the whole school doesn't make the 40, nothing. So this says, hey, if you're not doing anything in the public school, you don't do anything in the home.
Mm-hmm. And these are those classic homeschoolers that don't get any money from any other taxpayers. They pay for the public schools themselves, but they don't get any of that money.
Right. So anyway, okay, next bill is 1431. Children and Family Law, which was Parental Bill of Rights, a bill, and establishing Parental Bill of Rights. That passed 181 to 157, and what's amazing is there are now 391 representatives. 9 either resigned or a couple died, but yeah. So, and if you look at the numbers, where was like 40, 50 people. I mean, do your job. I mean, you know, you get elected, you're supposed to come and do it. So anyway, establishing Parental Bill of Rights, and if you go to the calendar, you can actually read what that is about. And so, parents now, there's a Parental Bill of Rights in Children and Family Law. Okay, so you want to cover something?
And so that one's mostly focused on rights and education. They had looked at doing some in healthcare, but it's a complex topic that hopefully we can follow up on next year.
Right.
So you want me to do some of the Health and Human Services on consent? Perfect. So most of our bills that dealt with the vaccine registry actually were on consent, which means that we got agreement in the committee about how to get the Democrats and Republicans to figure out how to improve our laws. So we have a vaccine registry just like most other states. Ours was authorized back in the 90s, but just was put into place last year. It was intended to be an opt-in system, but that wasn't really written into the law. And during the initial push, when a lot of this was provided directly by the state, everybody automatically was included in the registry. That's just what had to be done in order to get access to the vaccines. So we passed a requirement so that every time you get vaccinated for anything, you sign a form saying whether you want to opt in or opt out of the registry. So people are worried about people not participating, but we added a really nice carrot. If you're in the registry and you need a printout for summer camp, all you do is request it, and then there's all your records. You don't have to go to your doctor, you don't need to bother the overtaxed primary care, and so you get it. We have another on making it easier to withdraw because you have to go to your doctor today. This would allow you to get a notarized signature so nobody's impersonating you to take your information out, and prohibiting discrimination in the schools by schools or child care agencies if you're not in the registry. They have laws that say that you need to be vaccinated or have an exemption, so it doesn't change that. It's just they can't discriminate because you didn't put it into the state system. So it's great that we were able to get such good agreement on all of that, and that's a nice backup to 1608 that we had already passed, so that the Department of Health and Human Services needs to put out some press releases and put some banner ads on their website to let people know that they had taken their information, which is a violation of the state constitution. So this is how they can make it right.
Okay, good. That a simpler one in Commerce, 1583, liquor stores can now be open on holidays. Like they can be open on Christmas. They can be. It doesn't say they have to be. They can be. So it's up to. And for some reason, they can be open on every other holiday. But for some reason, the ruling came out that Christmas, Easter, and Thanksgiving they couldn't be open. But now they can be. I guess it's probably up to your local state liquor store. Yeah,
so I was actually going to look up the number, but we actually passed a great law to protect people that work out of state. So we had the lawsuit during COVID when they changed the rules, and it didn't really go anywhere because they said the state didn't have standing. It had to be individuals that sued. So we have language protecting the right of residents to only be taxed by other states when they're physically working in those other states. And so that'll allow the state to step up and protect our citizens if our citizens and residents, if that ever happens again.
Right. Good. And also remember, we just passed the House. These bills that pass have to go to the Senate, and the Senate make whatever they want, and then it goes to the governor. So they're not in law yet, but anyway, third of the way there. Now, two bills together here, 1131 and 1241 in education. 1131 is schools can no longer mandate masks. Only the governor and the Department of Health and Human Services and the Department of Education can. Your school board cannot. Also, 1241, similar, schools cannot mandate COVID-19 vaccinations. That's your parental rights choice, just like anything else. So those are two bills that passed, and so hopefully they'll make it through, and the governor. So we hear even right now the CDC and everybody else saying no mask and whatnot, and yet there's still some schools saying you have to wear masks. Let's hurt the kids. But anyway, you can't do that anymore. Hopefully, this will get through.
And so there was also one in municipal and county that makes it so that you don't have local decisions for public health, because we had some towns and cities that thought that they knew more than our State Department of Public Health. So that was another great law that we moved forward.
Right, good. I mean, it was getting ridiculous.
Yes.
You got something?
Yes, I guess if we want to dive into all of this fun stuff, we have 1022 to provide a pathway for people to get ivermectin in the pharmacies. I know that that one's been politicized, and that's why it actually has to be dealt with by politicians. It's a really, really safe drug, but it's not safe if you're taking veterinary ones, because they might have another dewormer in there, because that is one of the things that it's used for. So as a risk reduction, we have a way for a pharmacist to write a doctor to write a prescription and work with a pharmacist, so somebody can show up and say, well, call in. I hope you're not showing up if you have COVID. Call in and say, I just tested positive for COVID. I know this really only helps early on, and I'd like to get a prescription for ivermectin. So if this is able to work its way through the Senate and the governor, then we'll have access to that in the early days, because it's another thing just like Tamiflu. If you don't hit it early, it's not really worth doing.
Right. Another bill in education was HB 1261, and this was a bill prohibiting the use of North American mascots in public schools, colleges, and universities. That was the one I showed you on the YouTube, and it failed like it should have, because we have a school, I don't know what they changed it to, but our middle school had the chiefs. But what are chiefs? We had an Indian chief, but that could be any other kind of chief. And my argument on that, when I said, what about other ethnic groups? I mean, I found out some years ago I'm 24% Scandinavian. I might not like the use of Vikings, you know. I mean, but it's your local decision to do. I mean, and some group might say, hey, I'm a so-and-so and I would like maybe a new school called this. Fine. I mean, whether or not maybe North American, native North American, but you know, let's be a local school. Let's not do more of this cancel culture thing. And most people thought using a North American honored those people. I mean, or on any ethnic group if you name a school off them, but something, you know, let's cancel anything to do with culture. So anyway, that failed, luckily. Okay. Also, here's an interesting gun. 1434 allows parents to review curriculum. Material must be made available within 10 business days. So, for example, if they want to know what the curriculum is on a certain subject, it's got to be made available in 10 days.
And that one also makes it available to the taxpayers, because if you're paying for the curriculum, you should be able to know what's being taught.
Yeah, and maybe one of the things we should ask is what's the curriculum on Challenge Day, which is starting to cause some problems. The parents even know what was going on Challenge Day. So anyway, it'd be interesting to find out what happens there.
So I'm not sure if everybody knows, but a lot of the policies around vaccinations, around treatment, around visitor policies all came from DC. They came from the Centers for Medicare Services, because they said, if you don't follow our rules, we won't give you the money. Today, our hospitals, anytime you open up a hospital, you need to take all payers, which means you have to take Medicaid and insurance companies. The House passed a bill 1044 to allow hospitals to open up as cash pay hospitals or membership hospitals that won't have to take other payers. So that way they can focus in just on these people that probably want to be able to pay for an hour-long consultation with their doctor, and they want to be a high-need patient so that they can spend more time with that doctor and get all of their needs assessed early on. This is actually even more important right now, because all of the healthcare workers, the ones that have left because of their concerns over vaccination, they can't work anywhere, because if everybody takes Medicaid and Medicare and they need that for the facility to get paid, where are they going to work? So this is the perfect time to allow this, to see if it's going to develop in New Hampshire. It's worked elsewhere. It may or may not be the right fit for us, but it deserves a try. So I'm very thankful it passed the House, and I'm hopeful it'll also go through the Senate and Governor.
Yeah, I know this has come up before, and it allows, freedom of choice. I mean, a business can open somewhere to start a business, and they don't have to take Medicare or Medicaid. They can just, or any insurance, or even maybe an insurance company might want to open up a thing, let them do it. Okay, next bill in education, HB 1639, which we covered a while ago, is one of my bills. It makes an opt-in for youth risk behavior survey, and that's the one which we covered before. That's hopefully that passed, and we opt in, and hopefully we'll get it through the Senate. So now, so it's opt out now. It's the only opt out non-academic survey in your school system, but this makes it opt-in. So the opt-in is, somebody argues, well, nobody ever reads that stuff to find out. But wait a minute, when somebody comes home for an opt-in for a field trip, they all come back. So the only reason the parents don't send it back is they don't want the kid taking the survey. And all the surveys, we went through this before, it's online, you can see what the survey asks, and some parents may not want their kid to take that survey. So make an opt-in, which means to have a better chance of parents looking at it. Yeah.
Next one is our Speaker Pro Tempor's bill, Kim Rice. She unfortunately had some issues visiting family members at the end of their life this past year during COVID. And she, just like most of us, knew other people who couldn't visit people in the hospital, and then they ended up dying. There's been a lot of confusion over visitation policies, and this isn't designed to hurt any of the hospitals. But everybody's been so confused about when you can visit, how you can visit. We passed House Bill 1439, the No Patient Left Alone Act. What this does is it requires the hospitals to have a written policy that they have on their website and they put on the patient walls so that they know when somebody can be denied. And if you're asked to leave the room, they have to document it in the medical record. They say it's a big burden, but if your patient suddenly needs to have a procedure, if they write, they had this and we asked the family to leave, it's not that much more to document. The biggest fight over it, because everybody recognized this need for patients to have their family with them or their loved one with them, the biggest concern was whether we put it in the Patient Bill of Rights or if we put it in licensing. And honestly, I fought hard to get it into licensing because right now the Patient's Bill of Rights says that if you have a terminal diagnosis, you need to be allowed your family to come in. But we saw that denied time and time again during COVID. A law without teeth is only a suggestion, so putting this in the licensing statute is the right thing to do. And I believe these hospitals want us to have their patients see visitors, so I think this is going to be a good path forward.
Yeah, I think that's good. I mean, if somebody's dying and they want to be, and their relatives want to be with them, I mean, why can't, you know, they're dying. I mean, this is utterly stupid. I mean, there was another case similar in a nursing home. I got some relatives from Maine came to the nursing home to talk to the 90-year-old grandmother, I think it was, and the nursing home wouldn't let anybody in unless they were masked, including a 6-month-old baby. How can you mask a 6-month-old baby? So yeah, this is getting ridiculous.
And this does allow them to require masks or other PPE because we don't know what's going to happen in the future. But I still can't believe the idea of masking a 6-month-old.
Right. Yeah. Also, Education 1683. Remember we would discuss the Education Freedom Account. That was a bill to do away with it. In other words, let 1,800 students left out in the cold. The bill failed along with other EFA bills. Now, there's a lot of arguments going around about it's taking away money from public schools. It is not. The only money taken away from a public school after the 4th year is if a student leaves the public school. If they leave the public school for any reason, the state money goes away anyway. So, and the argument being, which didn't make any sense, was, well, only 1,600 of those 1,800 students didn't leave the public school. They were already in the private school or a homeschool type situation and took advantage of it. So the public school didn't lose anything at all because the state money followed the student. So this whole bit going around about these lies about it is it doesn't hurt right now. Yeah, if more kids were left, I believe the thing was raised for from 3%, 3 times the minimum.
So the federal poverty, that's for the scholarship program. The EFAs are still at 300%.
Right, the scholarship program went up, hopefully. But all the other EFA bills failed because we had 20 of them in the education committee. We had 103 bills. We normally have like 50, 60 at the most. So like double what we normally have in education. And a lot of it was a slow cut to the EFA program. They all failed.
There was one that would have helped out. That was mine, but it was all taken care of by rules.
Right.
The
yeah.
reason I had it in there was because we didn't know if the rulemaking process would work smoothly, and it did, because we have a great Department of Education and Board of Education.
Yeah, one thing about that with the, it was in the consent, I can remember what the bill was, but it's now, the Department of Education has oversight of the EFA program. So that was good. Yeah.
So we had a couple other great bills. We actually had House Bill 1455, the Speaker's bill. It's the one that says that New Hampshire will not be blackmailed. It says that New Hampshire is not going to be the enforcement arm of the federal government for these COVID policies. They're not paying us to do it. Our taxpayers shouldn't be doing that. And if they feel so strongly about it, then it should be their responsibility. There's a long history of doing that. There's red states that have Second Amendment laws like that, and we actually passed one of those too through over this past week. And then there's ones that have sanctuary city policies. So both of those say we're not going to enforce federal laws. So we and some other states said that about COVID policies. So that's one of those ones that is really going to go a long way to protecting our citizens. And we had a similar one too, because it isn't just the state doing this. We had some cities that were requiring businesses to check for vaccination status. There was definitely no agreement in the House about telling businesses that they can't check, because that's the business's choice about what they're going to do. So the question is, can a town or city force a business to check people? We saw in New York City that people were being denied entry into McDonald's because they weren't showing proof of vaccination. And that wasn't because McDonald's wanted to do it, it was because New York City said they had to do it. So House Bill 1495 simply says that the state, the towns, and the cities can't tell a business that they need to enforce a federal law. Because again, nobody's paying for it. It would be on the business owner.
Right. So there, it's getting ridiculous, and it comes down to the 10th Amendment to the Constitution. If it's not in the U.S. Constitution, then it's up to the states.
Amen.
Anyway, also we had a number of constitutional amendments this year. A constitutional amendment means that to pass the bill, 3/5 of the entire House has to vote. Not who's there, but of the, in this case, 391 people. So in order to pass a constitutional amendment in the House, it needed 235 people. And that wasn't going to happen. I don't know why anybody even put in. I think there was something like 25 CACRs, not a single one passed. And then also it goes to the Senate, then 3/5 of the Senate would have to. And then 2/3 of the people would have to vote for it. So it's hard to get a constitutional amendment in, even though we've had some over the years, and that were good ones. But some of these were utterly ridiculous. So hopefully, I mean, I don't know if we'll see any more, but it's not, I mean, people should realize it's not a time to do it. So another bill, an election law, 1153, because I mentioned the constitutional amendment because there were some constitutional amendments in election law. Absentee ballots cannot be mailed before a ballot request is received in the mail or in person. So in other words, we will find that was happening. Some town clerks were mailing out absentee ballots because somebody called in, can I get an absentee ballot? And no, you can't do that anymore. Okay, so, and folded ballots are still allowed, but they need to be folded correctly, and that's what happened in Wyndham, where they had the big difference. However, the moderator has the right to say they will be hand counted just for the absentee ballots.
I have, actually, do you mind if I take your next one here?
No.
Since I was a co-sponsor. Actually, I'll slip to the next one. In labor, House Bill 1165 is repealing the Granite State Paid Family Leave Plan. Right now, they're being offered in the private market for businesses. So that's going to be more competitive than the one that's designed to support the one for state workers. So this would just be creating a big benefit for state workers, and it'd be yet another program that taxpayers pay for their own and then pay for the benefits for state and local workers. And while it might be a noble idea, it's not something that the taxpayers should be responsible to do.
Right, I've noticed over the years, it's like all the stuff that an employee or their union can negotiate with their employer is now, a lot of that stuff is being tried to be put into law. So no, this is stuff that you work out with your employer, either with the union or an individual. It's not something that the law should say, you have to do this benefit. So anyway, I think we've pretty much run out of time. So hopefully, maybe next week we can continue on with the rest of the bills that have covered. So thank you. Thank you, Erica.
Thanks for having me again. Thank you all.